Since August 2023, communities across Ethiopia have been working to rebuild their lives, following years of crisis, conflict, and disrupted essential services. The Ethiopia Crisis to Resilience project, implemented in partnership with the Ethiopian Red Cross Society and the UK's Foreign, Commonwealth and Development Office, is supporting this transition, from emergency to recovery, and from recovery to resilience. In Benishangul Gumuz region, one of the areas most affected by past insecurity, the project has focused on restoring critical services in communities such as Komo, Bambasi, Tongo and Abiramo. Health facilities, schools, and water systems that were once damaged or non-functional are now being rebuilt, repaired, and strengthened. Access to safe water, once a daily struggle, has been significantly improved. Water systems that previously relied on costly and unreliable generators have now been converted to solar-powered solutions, ensuring sustainable and consistent access. Health facilities damaged by conflict have been rehabilitated and equipped with essential medicines and medical supplies. For many communities, this has meant the return of accessible, reliable healthcare.
As
the only primary hospital in the zone, Kamashi Primary Hospital serves as a critical lifeline, managing a high volume of referral cases every day. In the past, frequent generator outages made it difficult to carry out surgeries and provide round-the-clock laboratory services, leading to understandable frustration among patients and their families. Essential services were often disrupted. Maintaining a continuous oxygen supply was a challenge, and keeping temperature-sensitive medicines and blood safely refrigerated was a constant concern. Today, that story has changed. Thanks to the support provided by the project, these challenges have been overcome. The hospital can now deliver reliable, uninterrupted care, restoring confidence, improving patient outcomes, and strengthening its role as a trusted center of healing for the community.
በጀነሬተር ስንጠቀም ይሄ የፍሪጅ መድኃኒቶች በጣም ሲያስቸግሩ ነበር።
Before, when we used the generator, we had difficulty storing medicines in the refrigerator due to the lack of fuel. The medicines would not get the cold they needed. Because of this, we had difficulty administering medicines to mothers in labor, such as oxytocin, on time. However, the advent of solar power has solved all these problems.
አሁን ሶላሩ ከመጣ መቆራረጥ የለም በጥሩ ሁኔታ አገልግሎታችን እየሰጠን ነው ማለት ነው።
The ultrasound machine we received from the society just 2 months ago has brought a transformative change to our services. Before its arrival, pregnancy monitoring, especially for mothers, was carried out without the support of ultrasound technology. Expectant mothers often had to travel hundreds of kilometers to access this essential service, facing high financial costs and physical strain along the way. Today, that burden has been lifted. With the machine now available locally, mothers can receive timely and accurate care, closer to home, and with far greater ease and dignity. Despite harsh weather conditions and difficult road access, the project has reached remote communities, resolving long-standing challenges, including water shortages that affected daily life for years. At the community level, local capacity has been strengthened. Volunteers recruited from each kabyle have been trained to work alongside health extension workers, supporting outreach and basic health services. Ambulances provided through the project are now delivering 24-hour, free emergency services, bridging critical gaps in access to care. This hospital was among the facilities severely damaged during the recent conflict, an impact that tragically cost the lives of mothers and newborns seeking safe delivery care. Today, with the support of the Red Cross, the hospital is regaining its capacity to save lives. The previously destroyed pharmacy has been fully renovated and restocked with essential medicines and medical supplies, ensuring uninterrupted access to critical treatment. These improvements are already making a tangible difference, restoring essential health services and offering renewed hope to families who rely on this facility.
During the previous security crisis, large parts of the hospital were severely damaged, disrupting essential services. As a result, many mothers were forced to give birth at home, often without skilled care. Today, that reality has changed. With the support of the Red Cross, the hospital has been rehabilitated and is once again providing vital health services, restoring safe, facility-based care for mothers and their newborns.
Tongo Health Center is among the facilities that suffered severe damage during the conflict. Through this project, critical services have been restored, bringing new life back to the center. At a cost of 16 million baht, the damaged laboratory, inpatient ward, and maternal and child health (MCH) units were fully rehabilitated. The project also equipped the facility with solar power, essential medicines, and vital medical supplies, ensuring services can run reliably and continuously. To further improve conditions for patients and staff, a 4-seat sanitation facility was constructed, enhancing hygiene and dignity within the center. With over 5 million baht invested in solar water systems, and more than 20 million baht allocated for essential medicines and medical supplies, the project is making a tangible, measurable impact. Regional stakeholders highlight significant improvements across health, water, sanitation, and emergency response services. The solarization project has played a critical role, bridging the gap and bringing much-needed energy access to underserved facilities. Only 60% of health facilities and just 10% of health posts were connected to power. At the same time, significant progress has been made in strengthening medical resources. Over the past year alone, 21 million baht worth of medicines and medical supplies were delivered to Tongo Health Center and Kamashi primary hospitals. This vital support has greatly eased previous shortages, enabling the facilities to provide more consistent and effective care to their communities. To strengthen the health information system and empower professionals at every level, targeted training has been delivered on emergency communication, infection prevention and control, and disease surveillance, equipping teams with the skills needed to respond swiftly and effectively.
ማኦኮሞ እንግዲህ የከተማውን የንጹህ መጠጥ ውሃ ተደራሽ ለማድረግ ከፍተኛ አካባቢ ላይ የጸጥታ ችግር በነበረበት ወቅትም ያው
Despite the challenging security situation in Komo, 5 water wells were successfully constructed, providing communities with reliable access to clean drinking water. In Saretsra district, 2 additional wells were built and equipped with solar power systems, alongside a 1.2-kilometer network expansion, significantly improving water access for residents. In Kamashi district, the solarization of an existing water well has helped address the town's long-standing water shortages, ensuring a more stable and sustainable supply. Meanwhile, in the Aburamo district, critical technical issues were resolved, enabling communities to once again access safe and clean water.
በአሁኑ ታይም ያው ተጠቃሚ ሆኖ ህብረተሰቡ እየተገለገለበት ይገኛል ማለት ነው።
What began as a response to a crisis is now laying the foundation for long-term resilience. And the work continues, expanding to reach more communities in need. Together, we are rebuilding lives, restoring dignity, and strengthening communities.